What's the worst thing you've seen as a doctor? This is case number 3, the most surreal case that I've had. I was a very junior doctor in an emergency department. I'd been in Australia for a year. I was working up a patient who had had a fall. Common for older patients who have had falls to get a CT scan of their head, to get blood work. We cast a broad net because there's different things that can cause falls. And I couldn't really figure out what was going on. I did what all junior doctors do, and you go and find your senior and have a discussion about the case. I was talking to my consultant, and we looked through the CT scan. And I remember the consultant went, well, that's why it's fallen. And there it was on the CT scan, a really large tumour in his brain with signs of edema or swelling around the tumour. I hadn't even looked through this CT scan. I was so junior, I wasn't used to picking up things, but I should have at least looked. And so it was now my job to talk to the patient and his family about what we found. In a lot of cases of falls, we find that it's actually multifactorial. People have a lot of different issues that contribute to why they may have had a misstep or fallen over. But in this case, it was pretty clear cut. Around 10 o'clock at night, I remember getting all of his family together in a quiet room and discussing the fact that we'd found a brain tumour. This isn't my specialist field. I don't know what the treatment options are. I know that with some tumours and cancers, chemotherapy is an option, radiotherapy is an option, and surgery is an option. And there's also always the option of doing nothing. I talked through the fact that we found this problem, it's a brain tumour, the outcomes are usually quite bad, and that the next step is to get a specialist to talk to them and to assess the options. And this conversation went on for 20 or 30 minutes. I answered the questions that I could and deferred the others that I couldn't, and said that I'd do my best to find someone to be able to answer them. And then I let them talk together and I left them, and this patient was going to be admitted to the hospital. I packed my bags and went home. And it was only on the drive home that I realised that I'd been on the other side of this when I was a bit younger, maybe 10 years ago, when my dad was diagnosed with a brain tumour. And he kept on running into things. And he had a scan and it found a brain tumour with some swelling around it. And that's when we all had a conversation with a neurosurgeon. And it all just hit me that I was now being the doctor explaining what's going on. Unfortunately, in a high percentage of cases, patients die within a year. And it was the weirdest feeling to now be the doctor breaking the news to a family. It didn't feel like a sensitive topic going into that conversation, but now piecing it together on the way home, I bawled the whole way. I just stayed up thinking about my dad and thinking about this family that I've just broken the news to. That was a heavy one.